We will now move on to receive a briefing on the state of homelessness response system in Austin and Travis County by the Indian Community Homelessness Coalition, also known as ECHO. So I would like to welcome our Chief Strategy Officer, David Gray. Please, welcome.
Awesome. Thank you. Good morning, everybody. Happy Wednesday. In a moment, you'll hear from our good friends at ECHO. They'll be presenting to you some work that they've done around modeling needs for our homeless response system here in Austin, Travis County. I just want to take a note on behalf of the Homeless Strategy Office to first thank ECHO for being here and also thank our colleagues for working with us as part of this system modeling project. The beauty of this system modeling tool that ECHO has developed is that it presents us with some great insights as to what we need to do as a city and as a county and as a community to help build the homeless response system that our clients truly need in order to end their homelessness. The other beautiful thing about this tool is that it's a living tool. It's something that we can work with ECHO and modify assumptions, make some tweaks to some data points as we go, so that unlike some of the previous work that had been done where you get kind of a moment in time snapshot of the system and the system's needs, we'd be able to add and adjust as we go to recalibrate and make sure that we remain on track with respect to our goals and our priorities. And so with that, I'll invite up Kate Moore and the ECHO team to present to you the work that they've done around system modeling, as well as to answer your questions. Thank you all.
Thank you.
Good morning. My name is Kate Moore. I'm the Vice President of the Homelessness Response System Strategy for ECHO. I am here with one of my colleagues, Joseph Montano. He is the Research and Evaluation Director, and one of my former colleagues who has come back to help us present this, who worked on this modeling, Akram Al-Turk. He is now with the University of Texas. So let's see if I can do this. All right, so that's us. So ECHO, for those of you who aren't familiar, we are the backbone of the homelessness response system here in Austin, Travis County. One of our roles is the lead agency for the Austin-Travis County Continuum of Care. And one of our main responsibilities is to lead and align a coalition responsible for planning and implementing community-wide strategies to end homelessness. And this modeling fits right in line with that goal. So I'm going to give you a brief introduction and then go over the agenda. As David said, we're really excited to present these projections to you today. It's presented on data modeling on how our homelessness response system would need to grow over the next 10 years in order to work for everyone who needs it and reach functional zero. That means that we project that if our community funds this entire projected need, that within the next decade, we will be able to house every person currently experiencing homelessness and be able to quickly rehouse anyone who becomes newly homeless. Today, we'll be talking to you about current investments in the homelessness response system, including substantial financial support from the City of Austin. This support has been critical to growing our system, and you'll hear how providers are delivering on these investments, helping more people find housing in 2023 than ever before. We know there is more work to be done, which is why we will also be presenting financial projections of what is needed to meet the estimated need today and through the next 10 years. You're going to be seeing some large numbers. However, we believe these investments are necessary to reach the goal of supporting and housing all of our unhoused neighbors, and we believe that that is a goal worth reaching for. The modeling of the need that we are presenting to you today is based off of work that we did with a federal technical assistance provider and in collaboration with the city's Homelessness Strategy Office. We want to thank David and his team for working with us closely on this modeling to ensure that the projections are as accurate as possible. We're hopeful that after this presentation today that we can continue to work with the city, the county, and the larger community on creating a plan to meet these needs, and that we continue to provide updates to you on our community's progress and adjust our collective strategy and response. All right. So I'm going to dive in. So we're going to start with providing you some baseline numbers of where our system is now. So this is one number that we look at when we are asked the question of how many people are experiencing homelessness in our community. And there's a couple different ways to look at that. This is a number of people who have touched our system in any way. So this includes people who are receiving a deep dive service, such as permanent supportive housing, or it could be someone who received one service on one day and happened to be entered into our homelessness management information service in our database. So this is everybody who's been experiencing homelessness in our system. So you can see the growth from 2019 to 2023 is pretty substantial. Another way that we look at answering that question of how many people are experiencing homelessness in our community is the point-in-time count. And so we have two different types of point-in-time counts in our community, in every community. It's a sheltered point-in-time count, how many people on a certain day in late January are sheltered in our emergency shelters, and how many on that same day are unsheltered. We do a full census where we try to get about 1,000 volunteers to spread throughout Austin, Travis County, and talk to our unhoused neighbors and do a count and find out some demographics. So you can see that those numbers haven't drastically changed over the years, but there was an increase of about 600 in the sheltered point-in-time count from 23 to 24. We did not do a unsheltered point-in-time count in 2024, but we will be doing another one in 2025 in January, so coming up soon. So this chart on the right, a couple things we wanted to highlight for this. So this is not based off the point-in-time count numbers. This is based on the numbers in HMIS. This is showing us that our high chronic homelessness numbers. So you can see, so for instance, in 2019, we had about 25% of folks in our system who were chronically homeless, meaning that they have a disability and that they have been homeless for an extended period of time. And you can see that number has crept up in 2021 close to 30% and stayed at about 30% in 22 and 23. This is much higher than our peer cities and around the nation. So this number is concerning to us. We are going to see in our community, partially due to the City of Austin's investment, an increase in permanent supportive housing. We're already seeing an increase in people moving into permanent supportive housing. This will help us address this, but we need to keep our eye on this number. Another one to highlight for you that is high is our number of domestic violence survivors in the system. You can see about a third of the folks that we serve in our system are domestic violence survivors. Okay, so we have had a large investment in our homelessness response system. And you can see from this chart, these are the number of people that we are serving. And you can see that in the blue is minimal housing assistance. That is a light touch, typically assistance, maybe a diversion assistance, where somebody has quickly been rehoused typically. Permanent supportive housing is a permanent intervention. There's not a lot of turnover with that. You see a little bit of increase from 22 to 23, and you see a large increase from 22 to 23 of people housed in rapid rehousing, largely to do with the City of Austin's investment in rapid rehousing. And so you've seen our community providers have stepped up, and we have helped over 3,000 people find a place to live in 2023. And that's a 73% increase from 2019, and that's exciting. But one of the things we want to highlight is despite this large growth in the system, we are still playing catch up. All right, so Austin's inventory of shelter and housing remains the lowest among big cities in Texas and among the lowest among our peer cities. So this was an analysis that we did at ECHO to better understand why we're seeing this chronicity number go up. And you can see from this chart, for instance, that Houston has a much higher ratio of beds per person than we do in Austin, which is in the blue. So the orange cities are our peer cities, which have a higher ratio, and the purple are our peer cities nationally, and we are among the lowest in our peer cities as well. So I am going to turn it over at this point to Aqua.
Good morning, council members. Thanks, Kate and Joseph, for inviting me to join you all, and thanks to David and the HSO team for working with us on the system modeling. I'm just going to, jump into, how did we get to the numbers that Joseph is going to show you. I want to start off with, what is the framework that we try to use for this system modeling, right? So when we typically think about how does a homelessness response system operate, we typically think about short-term services that address short-term needs for folks. So you can imagine that's, emergency shelter, or maybe a one-time, rental deposit or something like that. And then we think about then long-term services like rapid rehousing, which is, between 6 and 24 months of support, or permanent supportive housing, which, as Kate mentioned, is more permanent for a lot of folks. So, we're in this system modeling and the numbers you're going to see, we're trying to address needs for folks who both have short-term needs and long-term needs. So we didn't just focus on one or the other. We wanted to focus holistically on the needs that everybody that is experiencing homelessness in Austin has. And the first step to us doing that is to get the data and to use data to kind of inform our framework and our numbers, right? And so, that is the first step that we took. We looked at HMIS data, which is our centralized database, to see how many folks need what we would consider short-term services and how many need long-term services. And I'm going to get to that in a second. But that is what we did with, as Kate mentioned, a consultant who has a lot of experience doing this in a lot of cities and states across the country. And so even though we do acknowledge that we need to address both short-term and long-term needs, we feel like we have to still take one approach. And so on the left here, you see that one possibility is to really grow the short-term services, right, to have a funnel like this. Another approach would be to really grow and have an inverted funnel and to really focus on long-term needs and long-term services while still taking into account the short-term needs that folks have. And so which approach did we take? Well, because people continue to fall into homelessness, and we've actually seen from the data from HMIS that we have a lot of people who are falling into homelessness. That number has increased over the last few years. And so the instinct, I think, when we see that is to grow to grow a bigger funnel to really increase the short-term services. But when you look into our data a little bit more closely, we see that the number of people who are experiencing long-term homelessness is consistently high in Austin and Travis County, right? Kate mentioned some of the reasons for that. I would say probably the biggest reason for that is that we are playing catch-up. Like, historically speaking, our capacity to house people and even to shelter and to have shelter for folks has been relatively low, our capacity to do that. And so that has, I think, created a situation where we have a lot of people who are experiencing long-term homelessness, who are chronically homeless, who have a disability, and who have been experiencing homelessness for quite some time. And so because of that, we think that the approach is maybe that we need an inverted funnel so that we can try to really exit people more successfully into housing, especially folks who have those long-term needs. That does not mean that we are not going to focus on short-term needs. And as you'll see in a few minutes, we're still trying to model the amount of short-term needs that we have in the system. And so, again, what this means is that we still need to take a true two-pronged strategy that provides housing options and services to people who need them, especially people who have been in the system or who have been chronically homeless for quite some time. And we still are advocating for, based on the numbers, the use of short-term services like shelter and diversion for people who are coming into the system. The data that we use, again, as I mentioned, come from HMIS, and the model is informed by that data. And I won't go into the details here, but I just want to give you a sense of the kinds of things that we looked at to make sure that the model is as good as it can be. We all know that models can get things off quite a bit, but we're trying to make some assumptions that we think are based in reality and based on best practices that will make the model as good as possible. But I want to reiterate what David said at the beginning, which is that this is a living model. We can continue to adjust the assumptions, and I think ECHO plans on doing that. But just want to start off here with one of the things that we looked at, which is the expected demand. So this is basically looking at people's history of homelessness. How long have they been homeless? How many times have they been homeless? What are their health conditions? Do they have income when they enter the system? Things like that. And then we had to make some assumptions about those folks, right? So people who are chronically homeless, we think, would be best served by permanent supportive housing. Some of those folks are going to be served by other programs. We know that, but they would be best served by a longer-term intervention like PSH. We also, another assumption, if somebody has some income, they could be served pretty well by a short-term service like diversion or rapid exit. So that might be, again, a one-time rental deposit or something like that to help somebody, get on their feet again. And so those are the kinds of things that we looked at, people's, situations, right? We also looked at unit turnover rates, capacity, things like that. So basically, we're saying, on average, how long do people stay in a shelter bed? How long do they stay in rapid rehousing? So what is the turnover rate for those beds, essentially, in those units? We look at capacity. How many shelter beds do we have in our community? Things like that. We also, and I'll end here, is that we also look at things like exit rates and return rates, right? We know that some interventions have better exit rates than others. Some have people who return to homelessness more frequently than others, and so we look at those numbers as well to say that some portion of people are going to return to homelessness, and we need to account for that in future years. That's why we're kind of doing a 10-year model so that we continue to kind of see, based on returns, based on how many people we expect to experience homelessness for the first time, what are we going to expect in the future and what are we going to need in the future? And so I won't go into details here, but these are the things that we modeled. These are the interventions. I think you all know these very well. We looked at how many shelter beds do we need, how many rapid rehousing units and permanent supportive housing units do we need. And then we also focused on things that we have less of in the system, but we have acknowledged, I think, both as a city, HSO has acknowledged this, ECHO has acknowledged this, that we also need prevention and diversion, which are the kind of shorter-term services, prevention being before somebody experiences homelessness and diversion being a light touch service after somebody experiences homelessness. So we'd really try to include all of these. We know that the system actually includes much more than this, right? There's outreach, there are other services that are provided, but we wanted to, simplify it to what we think are the most prevalent services and the ones that will probably cost the most, right? So I'll turn it over to Joseph. Thank you all.
So the first step to understanding what our need is across our system is to really understand the households that are utilizing services within our system. And this table is showing the HMIS data that we reviewed to estimate resource utilization from previous service data. And this table is showing the number of households expected to access services this year. So we have it split up by singles and families, and you can see all of the interventions that were provided before. But this is based on the past years of HMIS data, how many people we expect and pretty confidently know are going to be accessing these different interventions this year, both for singles and families. The next step then, as Akram mentioned, is to understand what our current capacity is. So the numbers that are listed on this table are the number of units for each of these interventions. We are including diversion and prevention, even though they don't have typical units like a site-based building or anything like that. But those numbers are determined by the contract amounts divided by how much it takes on average to serve somebody through that program. So overall, this is not going to be beds, which can be sometimes confusing with people understanding from our housing inventory count. We sometimes talk about beds, units. This is talking about units, so just one entire unit. So for emergency shelter, rapid rehousing, we have about 1,282 units for singles and then 207 units for families, and it goes across the table like that. So these are the two main figures that I want to emphasize and show you all, because we take these figures and then that's how we estimate and calculate.
I'm sorry, can I just interrupt?
Yes.
the system baseline is the projection that you need, that ECHO is giving, forecasting based on the needs, and then this slide is the current capacity. Is that right? I just wanted
So this is the number of households, so families or persons that we expect to utilize these services, and this is the actual units that will house or shelter those households.
Okay, thank you.
So the number is less because the number of people that get serviced by each of those interventions is going to be multiple times throughout the year from turnover.
Got it.
So we take those main figures, and starting off from the previous slide that we just reviewed, we start with our current capacity, and we use that number to calculate how many households exit to housing within a year. So from the previous slide, if we're looking at 1,282 units, we take that number, 1,282 units, and we multiply it by the number of times it turns over in a year, right, because shelter is going to be used more than once a year. And then we also calculate, in order to make it as realistic as possible, we calculate the utilization rate, because there's times in between people entering rooms or units, things like that. We really want to make sure that how many times this unit is getting used is as accurate as possible for our community. So when we multiply that current capacity by the turnover rate and utilization rate, we get at the top the households exited to housing. We then take that number and we go to the bottom formula, and we take that baseline that I originally showed you, so we know how many people are going to be engaging in services. We subtract how many exit from that top formula, and then we account for self-resolutions, returns to homelessness, and the number of people that are going to be newly homeless within the next year. And what that tells us then is that kind of gives us our baseline for the next year. And that tells us how many units are needed regardless of whether or not we have them in our system. So, for example, our baseline showed that 3,720 households will be utilizing emergency shelter this year. Our current capacity for emergency shelters is 1,282, so we multiply that by the turnover rate, which is 2.43, and our utilization rate of 90% to get 2,808 households served. So that would be the top number. We take that 3,720, subtract that 2,808 for the people that are exited. We account for self-resolutions, returns to homelessness, and newly homeless, and that gets us 2,983 people that still need services at the beginning of the next year. And so we did this over and over and over again, and we tested out different units, how many units we could incorporate, what types of units, and what would be the ratio between rapid rehousing, permanent supportive housing, to get the number that would get us to functional zero as quickly as possible, to where as many people are entering the system will be exited within that year. And so this is the system model. These are the total number of units that are going to be required in order to meet functional zero within 10 years. So for emergency shelter, we're going to need 550 units of emergency shelter. All of these numbers are both singles and families included. For rapid rehousing, we're going to need 2,355 units of rapid rehousing and 4,175 units of permanent supportive housing. We've included the total costs there on the bottom, so you can see that for emergency shelter, over 10 years, it's going to cost us approximately $24.4 million. For rapid rehousing, it's $104.4 million, and then for permanent supportive housing, it's $217.4 million. We know that it's not going to necessarily be possible to inject this many units at once, and so our model accounts for trying to increment the number of units as gradually as possible while still meeting functional zero as quickly as possible. So the very top row of this table is showing you, not on average, but the most frequent increase of units for that intervention per year. And we'll go over that more in detail with the next slide. We'll actually look at the year-by-year breakdown for all of these units. But I just want to highlight that we haven't included estimates for additional diversion or prevention, and that's just because we don't really have enough historical data to really estimate how they're going to be exiting and returning from those interventions. Those interventions are fairly new with a lot of great investments from the City of Austin, but we just don't have the historical data to develop the same types of models that we could for emergency shelter, rapid, and permanent supportive housing. And in addition, this does not include the service dollars that are going to be required for the PSH pipeline. We're very grateful for that pipeline coming online, but the per unit costs for these are not the same if it's just required to have services. So the cost wouldn't be accurate if we included those number of units. So as I promised, this is the year-by-year breakdown for singles across these different interventions. And so as you can see, the median increase for emergency shelter was 100, and you can see on the top row that we're suggesting an increase of 100 units for singles over 5 years. Additionally, we've notated known changes in our system, so that includes the numbers in red. We know that we're going to be losing a lot of units from the ARPA cliff that's coming up, and that's expected, and so we've included those in terms of how that's going to affect the number of exits that we have, as well as the PSH pipeline, because we want to include how many exits are going to be resulting from those units, even if we can't account for the costs. And then from there, we have the year-by-year breakdown. Most frequently, the increase is going to be somewhere between right over $30 million for all interventions per year. We know from our research and testing this model frequently that the earlier we can inject units is better. It means that people will be exiting the system quicker, and it means that we'll be able to reach functional zero sooner. We also discovered that early injections of emergency shelter are very beneficial for moving people out of the system more quickly. And so that's why we've included investments early on for emergency shelter with gradual increases for permanent supportive housing and rapid to try to make it as minimal an increase per year as possible while still reaching functional zero as quickly as possible. And so from there, I'm going to show the family slide here so that you can see the number of units that are suggested, and then I'll pass it off to Kate Moore for our recommendations.
All right, thank you, Joseph. So this is the family slide, and these are our recommendations. So we recommend that you expand investment as inversion. We know this is a very cost-effective way to get folks out of homelessness very quickly. We also suggest developing new investments in prevention. We know this is an interest of the City of Austin as well, but this would help us stabilize the inflow of folks moving into homelessness. We encourage you to continue to collaborate. Collaborate with your unhoused neighbors, collaborate with people who have used these services, collaborate with the county and other stakeholders, and we would like to make this a living model. We intend to do so, and we would welcome an invitation to come back on a regular basis and present to you updates on the model as things change and evolve. And we lastly encourage you, even though you saw some big numbers, we think it's possible. We encourage you to partner with other funders of the system and to fully fund this model because housing everybody is the ultimate goal. And we really appreciate your time today, and we welcome any questions.
Thank you. Colleagues, Councilmember Ryan Alter, you'd like to kick us off?
Thank you very much. Where to begin? I'm curious, we had a model, and I see Gary here in the room. The city developed a model a few years back on what we felt we needed, and I'm curious from HSO's perspective how this model matches with ours, and if from vice versa, if y'all have looked at that and can see. But I just want to know, are these similar conclusions, different conclusions? Are they based on each other?
I'll let Acrobat if he has anything, but we use the same consultant, if it's helpful to know, that the city used for the Investing for Results report. So the city had hired Bob Poppy and Associates to do a report that included a modeling. And so we were lucky to be able to work with Matt White, who was the person who she had working with the city on that modeling. So my understanding is that Matt used the same methodology in many ways, but was improving as he goes because he's been doing this nationally. But we were able to tap into that same expertise. Does that feel like it accurately captures it? Okay.
I can add really quickly that if you look at the numbers from that report, I mean, I think they're very similar, at least the breakdowns. I think I remember that I think it was a proposed that we need more than 4,000 PSH units. I think I'm remembering that number correctly. And so in terms of long-term versus short-term services, I think the breakdown is very similar to what we have here. So.
And y'all have annualized these needs. I'm curious how you have factored in population growth and increases into our homeless response system. Are we taking kind of the current need and distributing it out and then applying any adjustment factor for we know over the next 10 years we're going to have even more, or how is that accounted for in this?
Well, I mean, it's not a very complicated way of doing that, but we do account for new people experiencing homelessness. There are different ways to do it. I know that Matt White has accounted for, looking at the poverty rate in the city, and then you basically estimate how many people you think are going to experience homelessness. I think we did it a little bit more simply and just assumed that there's going to be a steady number of people who are experiencing homelessness for the first time. So we're taking that into account. I think we could certainly refine that, but we're definitely taking that into account.
I can interject real quick. I just want to contextualize what this modeling does. And first and foremost, thank you so much to ECHO and team for putting this together. This is exactly the type of information that we need as a council to ensure that we are making the appropriate investments into our homelessness response system. And just want to highlight the sheer scale of the need that we have in our community. What you have laid out here in your assessment of our overall homelessness response system is a need of about $350 million over the next 10 years. Is that fair to say? Okay. $350 million needed over the next 10 years. To me, that sounds like a manageable number that we can make if we make the necessary strategic policy proposals, if we advance them, as well as make the necessary investments, because we know in the long run that is a more cost-effective way for us to ensure that we have the stability for everyone that lives in our city. So I guess part of my question I have, or colleagues, what I want to highlight, bring to your attention, is that the investments needed by year, you'll see for 2025 for rapid rehousing, we have a deficit of $430. We've known the ARPA cliff that is coming. We've talked about it at our last budget cycle, and I just want to layer in for the next budget cycle, because we know that it will come faster than we know it. If we can have Mr. Gray, our homelessness strategy officer, kind of walk us through, based on the assessment that we see here and knowing the PSH pipeline units that we have coming online by the end of this year, and of next year, can you just talk us through, how these numbers look, or how might they look differently when you account for the PSH pipeline units that we have?
Sure. Councilmember David Gray, Homeless Strategy Officer. I do believe that the system modeling has included or incorporates the PSH units that are coming online, the rapid rehousing slots that we're losing. Again, the beautiful thing about this model is that we can adjust it as we go. And so as we see units come online sooner or later, we can also play around with those annual counts of how many more units we think we're going to need. Just to answer your question around the ARPA, you're right. We're at the point now where all the ARPA dollars are allocated in about a month or so. They're all going to be encumbered. And now we're just managing those contracts and spending those resources down for programs like rapid rehousing, where we know we have clients who are receiving that service and they just need more time. We focused a lot of our energy to putting more funds into those contracts to try to sustain and extend the time horizons that those clients have to receive services until we're able to figure out what a successful exit strategy looks like for those clients. The other work that we're doing kind of parallel to this in our office is we've begun looking at different cities and different funding structures in other cities. So trying to better understand how our peers are funding their homeless response system, whether it's primarily through corporate giving and philanthropy, or maybe through a multitude of public financing strategies, everything from dedicated taxes to endowments that are managed by cities in cooperation with local foundations. And so there's a multitude of approaches that we can take to try to address the funding needs that we know are coming and actually are here right now. And we look forward to presenting that information to you at a future date. The last thing that I'll just say really quickly is, what this model looks at is the additional capacity that we need in order to achieve functional zero. We also know the reality is we have existing services, existing programs that also have budget deficits and budget gaps. We have new shelter coming online at Camp Esperanza, and we need supportive services for those. We have our new PSH units that are about to open, and as we talked about during the budget work sessions, we also need new supportive services funding for those. And so this number is a good number in terms of the system that we have to build. The other work that our office is doing is looking at what's the true funding gap for the system that we have today, and how do we make sure that as we build for the future, we're also taking care of the organizations and the providers that are delivering services to our folks today.
Thank you for that distinction, because that brings to mind one of the previous work sessions that we had, and can you clarify, was it a $22 million or $11 million that HSO is recommending as ongoing funding needs for the current system that we have?
Unless I don't have that number committed to memory, and I'm going to look to Gary. Gary doesn't have that number committed to memory. Can we get back to you with that number, Councilmember?
Absolutely.
I do apologize for not having that information readily available.
Because on the one thing, we went through that work session, the thoughts I had after the work session, once we had time to sit with that presentation, was that to me still seemed low as far as the gap funding needed for our current capacity. And so really knowing that we have a gap to fund our existing system as it is today, we now have this really great framework for the modeling of how do we build out a robust homelessness response system, and knowing the funding needed for emergency sheltering, for rapid rehousing, and permanent supportive housing. Not to even count the prevention and diversion services part of it. You mentioned staff working on a recommendation of potential financing tools and methods for council to consider. When do you think might be an appropriate time for us to have a more extensive conversation? Because for me, it's going to be really important that we have these conversations well in advance of next year's budget session.
Correct. So our internal clock is to make sure that I have information that I could share with city manager's office and city leadership before we get to the mid-year spending plan session. That way we have multiple months to kind of sit with the information and really look at my budget to see are there things that I could change this year to help address needs, and then as we plan for future budget cycles, kind of having those conversations early. That being said, I also have a lot of ask on my staff right now, and so our ability to do this work might get impacted. But again, our internal clock is to try to get this information to a point where it's ready for distribution to you and the city manager's office sometime early 2025.
Very good. Thank you.
Thank you.
Colleagues, further questions? Yes.
If I could follow up on that more specifically, I remember from the slide we had within the homeless strategy office ongoing need. There was 9.6 identified as still kind of unidentified for the marshalling yard. And then as we look at rapid rehousing, that was a $42 million allocation of our ARPA funds. That was a 2-year deal, so it's about $21 million a year, correct?
Yes, sir.
So that right there, just those two items, that's $30 million. We've got to figure out some revenue source if we're going to continue all of that. That kind of builds into when we talk about permanent supportive housing. A concern that I've had for a long time, continue to have, is it takes years to get these projects funded, planned, go through the tax credit program. I mean, we just cut the ribbon on a few of them, Pecan Gardens, bungalows. Those projects have been going on for 4+ years in some cases. And so if we came here today with $100 million, $200 million, pick your number, right? But we would have to start that process today to start meeting the need of 2028, 2029 if we were acting quickly. These projects just take forever. And so I am very worried that we look at a plan like this and say, okay, well, we've got till 2028 to spend $33 million for PSH, or it's a cumulative number, but I imagine a large part of that is PSH. And we might make that investment then, we won't see the result for many years to come. And so we've got this great pipeline because we have invested ARPA dollars for years now in the county as well. But if we don't have a plan now for 2028, we will fall off another cliff. And so as we have discussions around a bond in 25 or 26, I think identifying bond funds earlier rather than later, whether it's through the current affordable housing bond we have or potentially a new bond specifically for deeply affordable housing, including PSH, we can't wait and say we'll do it down the road because these developers won't come in the door and say, well, I've got this project, this project, or this project, because they don't know if the money's there, right? Why spend $200,000 on a pre-app if you don't know that there are dollars behind it to get the PSH? So I just say that all in as we talk about spending plans and what we need to budget. I think it is crucial that we come up with a capital plan or needs understanding for how do we get 500 units of PSH in 2028. What would that require? And I guarantee it would require action probably yesterday. So that is just a huge, huge concern that I have as it relates to the capital funding for.
Well, and Councilmember Alter, it might be worth for our committee to issue a recommendation. I mean, on that note, I am also with you on us really prioritizing as a body the needs of our homelessness response system. So I think our committee making a recommendation for the full dais leading into this mid-year budget process is going to be important. So
Yep.
I'll certainly work with you on that for our next meeting.
I appreciate that. I would love that. I guess one of my final questions. We talk about the data. This is all reliant on the HMIS data. How many people do we think are outside HMIS in the homeless? Well, not in the homeless response system because then they'd be in HMIS, but that are unhoused in Austin. Do we think it's 80% covered, 90%? 50%? I have no concept of how accurate we think our data are.
And I'll probably have to yield to the team at ECHO to answer that question. What I will say is I am extremely confident in the quality of the data that we have. In fact, we have other cities that are looking to Austin and looking to ECHO to understand how we've built such a robust database using HMIS. So many of our peer cities still use the PIT count, or they're trying to get to where we have been able to get to in terms of the quality of the client data that we have in HMIS. Is it perfect? Do people fall outside the cracks? Definitely, and I don't know if the team at ECHO has a sense of that, but I do just want to underscore my complete confidence in ECHO as our HMIS coordinator and all of our partners who use HMIS, some who are forced to because in all of our city contracts we require them to use it. Others who use it because they recognize the value of having that quality of information inside of a centralized data source. But, with that, maybe let me turn it over to Kate or somebody from ECHO to see if they can give you a sense around the confidence measure of the HMIS. You guys have a sense of that? Is there any way of knowing that?
Yeah, I'll reiterate what you said, David, which is that I've spoken with other communities that have noted that their HMIS coverage is probably much lower than ours. They know that a lot of service providers are not in HMIS, and we know that almost every service provider is in HMIS, and to varying degrees, but almost every service provider is. Now, I think the bigger question that you're getting at is how many people who never engage with services at all are not in HMIS, and I think it's hard to know that for sure. I will say, and maybe you've heard us say this a lot, but we've increased, or the system has increased outreach capacity considerably in the last few years. The number of coordinated assessments that are conducted has increased dramatically in the last couple of years. That tells me that more people are, especially because outreach is increasing, which means that people are, providers and outreach staff are going to folks directly who may not have been service engaged in the past. And so I think that it raises my confidence that a lot of folks that are experiencing homelessness in Austin are in HMIS just in some way.
Yeah, and I asked the question both from an understanding of the system, but also for the public, who we are clearly going to be asking to make large-scale investments, and rightfully so, they are going to expect results from those investments. And if, I hate to say, but the reality is, if they still see the person standing on the corner, then they think that is money not well spent. And so, just trying to understand, if we deliver everything in this packet, what will the public perception be of how successful we were? And that is a reality of what we're trying to do here. So just kind of want to understand how many, the outside of the system, and I'm not looking for names, but just, well, I will leave it with, we were all lucky enough to go to Denver and really see what can be accomplished when something, and in that case, homelessness, is made the top priority. And when a city decides that we are going to focus on something, focus our effort, our time, our resources, really incredible things can be accomplished. And for us to be able to have the type of impact that I think we all want to have, I do believe we are going to have that type of focus, and making something a priority requires you to make it a priority at the expense of something else. And so I know that the area I represent is ready for some of that trade. I am ready for some of that trade, and it's my hope that as we continue these conversations, that we decide this is a high or number one priority of the city, and we're going to put the time, resources behind it. So I appreciate the time. A little slow and weary this morning, but thank you very much.
Yeah, thank you. And again, colleagues, I know this morning is weighing heavily on all of us, so certainly appreciate y'all's consideration today. Any other questions, comments? Thank you.